American healthcare system, the types of health insurance and coverage option for immigrants, and accept how does the U.S. health system work. Healthcare in the United States is organized in a complex bureaucracy, while in the rest of the world, healthcare facilities are owned mostly by governments or by private sector business. In the U.S., a large share of hospitals and clinics are owned by private non-profit organizations, yet the United States is the country that has the highest healthcare expenditures in the world. While these expenditures are covered in a large share by public payers as by federal institutions or state and local governments, they can also be covered by private insurance and individual payments. At the same time, unlike most developed nations, the U.S. health system does not provide health care to its entire population, as there is no single nationwide system of health insurance. The United States primarily relies on employers who voluntarily provide health insurance coverage to their employees and dependents. In addition, the government has programs that tend to cover health care expenses for the fragile parts of the society as the elderly, disabled, and the poor. These programs differ from another and all have a specific kind of people that are subject to getting health insurance. In the US is not an easy thing. Someone may think that once you have money everything is easy peasy, but in fact things are a bit more complicated. One must be very careful and look out to pick the right insurance. Health insurance in the United States for non-citizens. The United States government does not provide health insurance for all its people, and health insurance is not obligatory for those living in the US. It is optional but highly recommended and necessary since health services are very costly, more than in any other country anywhere across the globe. There are two types of health insurance in the US, private and public. Most people use a combination of both. The US public health insurance are Medicare, Medicaid, and Children's Health Insurance Program. Travel insurance for visitor in USA, health insurance for international student in USA, health insurance for dependents of international students, health insurance for J1 visa holders, health insurance for foreign workers on an H1B visa, health insurance for dependents on an H4 visa holders, health insurance for green card holders, health insurance for K1 visa holders, health insurance USA for Canadian expats. The US has the most expensive healthcare in the world. That's why getting adequate health insurance coverage comes highly recommended. Medicare is a national health insurance program that dates back to 1966. It provides health insurance for U.S. nationals older than 65 years old, but also for younger people with end-stage renal disease, ALS, and some other disabilities. Data shows that in 2018, Medicare provided almost 60 million individuals with health care in the US, over 51 million of which were older than 65. The Medicare program is divided into four parts. Part A, which covers hospitals, skilled nursing and hospice service. Part B covers outpatient service, including some provider services while implemented at a hospital, outpatient hospital charges. Part C is an alternative called Managed Medicare, which permits patients to select health plans with at least the same service coverage as Part A and B. Patients select health care plans with at least the same service coverage as Part A and Part B. Often the benefits of Part D and an annual out-of-pocket spend limit which A and B like to sign in this Part 1. Most sign in Part A and B first. Part D covers mostly self-administered prescription drugs. Medicaid is a federal and state program that helps people with limited income and resources to cover medical costs, while covering benefits normally not covered by Medicare as nursing home care and personal care service. It is the largest source of funding for medical and health related services for people with low income system in the United States. Data shows that the US provided health insurance to 71 million people with low income or disabilities, which is 23% of the total of the US population. Children's health insurance program, formerly known as the State Children's Health Insurance Program (SCHIP). This is a program that covers with health insurance children of families with modest income that are not low enough to qualify for Medicaid.